Facial bones. All right. So we covered this in your Positioning 3 class, so this is just a quick review, but I'll show you what it looks like on CT and MRI. So starting out with this diagram, you have your optic foramen. It's a little hole right on the inside with your lacrimal bone, ethmoid bone. You have your zygomatic process of your maxilla. You have your infraorbital foramen. There's a supraorbital foramen also right up top. And going down, we have your inferior nasal concha and your anterior nasal spine, which we call the canthion. There's a mental protuberance, and across the bottom and across the top, so underneath is the velar process of the mandible, and up top there's the velar process of the maxilla. You have your vomer here along, coming up from your canthion, and then it turns into your perpendicular plate of your ethmoid bone. You have your inferior orbital fissure and zygoma, and the superior orbital fissure right up top there in your frontal process of your maxilla. So that should be good review for you moving forward. So lateral view. Coming around, we have your zygomatic arch with your zygomatic process here, your EAM, your mandibular condyle with your mandibular notch, and your coronoid process. This is the body of your mandible, the goyon there, your mental foramen, and a velar process of the mandible, a velar process of the maxilla, your temporal process of your zygoma. Here's your zygoma, your canthion, your lateral groove, or lacrimal groove, I like that, lacrimal groove, your ethmoid bone deep in there with your lacrimal bone. Here's your nasal bone. Here's a magged up view. You have your orbital plate of your ethmoid bone. Back in the back, there's your palatine bone. This is your sella turcica of your sphenoid. Of course, your sphenoid bone, your pterygoid plate of your sphenoid, a velar process of your maxilla, your maxillary sinus, your canthion, infraorbital canal coming through here, frontal process of your maxilla with your lacrimal groove on your lacrimal bone. You have your nasal bones up top. Your orbital plates are here of your frontal bone and your frontal sinus. Here's a coronal view of your facial bones. This is CT, your crista galli sticking up, your perpendicular plate heading down lower is your vomer. Your inferior nasal concha is the meaty part, so try to remember that. And here's your maxillary sinus, palatine process of your maxilla. Here's your maxilla with your zygomatic process of your maxilla with your zygoma up higher. So your middle nasal concha. So inferior is lower, middle is the next. This is a CT. This is a coronal slice, your frontal bone, frontal sinus, nasal bones, and this is your frontal process of your maxilla coming down on either side, and your perpendicular plate down the middle. Inferior view, coming around, you have your palatine process of your maxilla with your palatine bone. Posterior to that, zygomatic arch with your temporal bone, foramen magnum, occipital bone, and your zygoma there. So this is what it looks like on CT. So we have your palatine process of your maxilla with your horizontal process. This is your velar process where the teeth are. Back in the back, this is your mandible, your styloid process, just the tip of it you're catching there, and your pterygoid process of your sphenoid. So you can see here, this is your velar process of your maxilla. You can see where it's cut, so you know if it's cut down lower, you know it would be of your mandible. All right, so here is your maxilla, your zygoma, and the temporal process of your zygoma with your zygomatic arch, your mandibular condyle, occipital bone, your foramen magnum. You have your nasal septum is the bony part, and the inferior nasal concha is next to it, so that's what it looks like. And of course your maxilla and your maxillary sinus. You have your nasal bones across the top, and just right at the top you can see actually a little divot there. That little divot is where it goes from nasal bones into your frontal process of your maxilla. Posterior to that you have your lacrimal bone. This is your middle ethmoid sinuses and posterior, and this is your sphenoid sinus. This is just a zygoma coming across here with the greater wing of your sphenoid. Dorsum cello right back there. Okay, this is your osteomeatal complex. We've covered this, but we're going to cover it again. So you have your ethmoid bulla. Now, I remember the bulla because it looks round. You'll be able to tell the difference because it's very round. So your maxillary sinus drains through your infundulum down to your middle nasal meatus. Remember that? So coming across here, you have your inferior nasal concha. Remember, concha is the meaty part, and you have your middle nasal concha and your ethmoid sinus up top. This is a sagittal view of the meati coming around your frontal sinus, of course, sphenoid sinus. I wouldn't have you label this station 2, that's too small. So inferior nasal meatus, middle nasal meatus, and your superior nasal meatus. And then we have coming over here is your inferior nasal concha, middle nasal concha. This is MRI. This is a T1 sagittal. Pituitary gland, sphenoid sinus, and you have your nasal conchas you can see really well. So your inferior middle, and in between the black stripe is your meatus. So inferior and middle. CT image, this is a coronal. You can see where it's cut through. So we have the maxillary sinuses, ethmoid bulla, nice and round. Your infundulum where it comes up and out, and this is your inferior nasal meatus. So when we're looking at the mandible coronoid process, you have your mandibular notch with your neck and your condyloid process, your ramus, your gonion, your body, your mental foramen, a little opening there, mental protuberance, your symphysis, and your velar process of your mandible. This is a CT3D. We have mandibular notch with your zygomatic arch. Here is your mandibular fossa of your temporal bone, your EAM there, condyloid process of your mandible, gonion, body, mental foramen. Here's your velar process of your mandible, coronoid process of your mandible. This is your zygoma there. So anterior clinoids, look where we're slicing. You can see we're going through the anterior clinoids. So ground yourself by looking at the map. Sometimes the cross-reference images are off by a little bit. This one seems to be pretty good. So you have your anterior clinoids, your sphenoid sinus, I wouldn't have you label the foramen rotundum. That's just mean. It's too small. Zygomatic arch, your ramus of your mandible, and you can see here we have your pterygoid, the hamillus portion, and your medial and lateral pterygoid there. This is your greater wing of your sphenoid. So maxillary sinuses on either side with your zygoma, your coronoid process, and your notches in between with your condyloid process. Here's your occipital condyle with your foramen magnum, and here is your ramus of your mandible. Temporal process of your zygoma and your zygomatic process with your condyloid process or condyle of your mandible, hypoglossal canal with your foramen magnum. So looking at the TMJs, they show really well on MRI. We do CT on them as you've seen earlier. So here's your articular eminence with your mandibular fossa. Here is your meniscus and your condyloid process. Here's your lateral pterygoid muscle. Okay, so you're going to see a lateral and a medial muscle. Here is MRI. This is sagittal MRI T1. You can see the condyloid process and the disc right here. So this is closed, this is open. You can see the disc is still intact. That's the main thing that we're looking for. So diagram, the main thing I wanted you to see here is you have your meniscus, you have a fibrous capsule with the joint capsule. So if something tears, the disc is going to displace. You can see it well here. This is a sagittal T1 MRI, your condyloid process with your articular disc, your meniscus. So muscles that I want you to know, temporalis muscle, your masseter muscle. You have your lateral and medial pterygoid, so you can see the laterals coming straight anterior, so it's going A to P, and your medials are oblique. So we're looking at an MRI T1 sagittal. Here's your masseter muscle. Your buccinator is here. This is your hard palate. Bones look very different on MRI than they do on CT. And your temporalis muscle coming down here. So here we can see your masseter muscle, and you have your condyle, and you can see your lateral here, pterygoid muscle. CT shows it a little bit better. Here's your medial pterygoid, and here's your lateral pterygoid, and your masseter muscle is here. Your temporalis is coming down to attach. Sinuses. Frontal. We've got the sphenoid in the back. You've got your ethmoids and your maxillary. And great sagittal view. Here's your frontal. Here's your anterior, middle, and posterior ethmoid sinuses. And you have your sphenoid there in the back. And of course your maxillary. So you've got your nasal bones, your lacrimal bone, your ethmoid sinuses with your sphenoid sinus. Ethmoid sinuses here on CT, coronal. And you can see your middle nasal meatus with your inferior nasal meatus, and your concha, your inferior nasal concha with your middle nasal concha. Okay, so maxillary bone, zygomatic bone, maxillary sinuses, nasal septum with your inferior nasal concha. This is CT coronal slice. Here is your sphenoid, your middle nasal concha, your inferior nasal concha.